This 6-minute film describes how to inject local anesthesia for wide-awake carpal tunnel surgery. It is the first of 4 films showing carpal tunnel release and cubital tunnel release in the same patient at the same procedure using field sterility. We start by explaining the don't move rule to the patient.
And that's the don't move rule, because it's normal to want to go ouch when somebody puts a needle in your hand, but if you don't go ouch, then it only hurts once, because if you did, I'd have to stick it back in, okay? So there's the ulnar nerve and there's the median nerve. We're going to go right in between because we never want to elicit paresthesias. So I'm going to go right in here. Don't move. Ouch. Very good. And I just blow just a little bit right underneath the dermis. Not in the dermis where the nerves are, but underneath the dermis. And then I pause for just a moment and let the local anesthesia work before moving the needle around so he doesn't feel the needle move around. Now, is that hurting at all there right now?
No.
No. So now I'm going to just add a little more right underneath the skin, and the whole idea here is to put it in slowly. And this is 0.5% lidocaine with 1 in 200,000 epinephrine and bicarb at a 1 to 10 mixture for the lidocaine with epinephrine. And I'm using 0.5% because we're doing the elbow as well. And so is that hurting at all right now?
No.
And it shouldn't, because the pH has been balanced to 7.4, and I'm injecting very slowly. The key to good local anesthesia for wide-awake carpal tunnel release is slow. And you can see the skin wheel is coming out. There's the skin wheel right there. And I'm just going to slowly go ahead and put in 3 or 4 cc's just underneath the skin. And now, as I do that, I'm going to advance, but I don't advance in jerk-like fashion. I advance just very gradually, which I'm doing right now, and I'm blowing slow before I go to get underneath the forearm fascia. Is that hurting at all right now?
No.
So far you felt the first little poke, right?
Yes.
Nothing since then?
No.
Okay. You tell me if you feel anything else. So I've just advanced it now so that I'm underneath the forearm fascia, which is where the median and ulnar nerve actually live. And so now you can see a subfascial wheel starting to form right there. And that is a good thing. That means that the local is going where I want it to go. And I certainly want this gentleman to tell me if I hurt him at all at any time. Could you do that, please, sir?
Yeah.
Okay. So now I'm underneath the forearm fascia. I'm getting a forearm wheel, and normally I would use about 10 cc's. And what this does is it tumesses the median and the ulnar nerve. And then I'm going to go away and see a couple more patients while this gentleman's local anesthesia is working. And some people think that this is overkill, it's too much local, but this concept of tumescence blows lidocaine and epinephrine everywhere. You never elicit paresthesias to get a nerve block, because that means you've just lacerated nerve fascicles, and that's what you do to people you don't like. I really like this gentleman, so we're not going to do that. So now there's 10 cc's of local there. I'm going to change my position. You never inject where it's pink. You only inject where it's white, and it's white all the way to here now. So I'm clearly safe in this zone. At least I hope I am. Did I hurt you at all with that last little needle poke?
No.
And so I always want at least 3 or 4 millimeters of local anesthesia ahead of where my needle is. And so I advance the needle very slowly, and I'm always saying in my head, blow slow before you go. Blow slow before you go. And I can feel the local blowing up here, so I don't need to draw back. I'm palpating as I go, and the goal is to get 3 or 4 millimeters of white, or 5 even, and firm local anesthesia on either side of this incision. Now here I'm clearly anesthetized there, so I can move my needle to right there with impunity. And once again, the plane is just underneath the dermis where the nerves and blood vessels are, and you always want to have lidocaine and epinephrine molecules everywhere you're going to cut. And because the epinephrine's there, and it's been well shown now that you can inject epinephrine in fingers and there's no damage or danger there, we don't need a tourniquet, and we certainly don't need sedation. And we're going to ask him what he thinks of comparing this to when he gets local anesthesia at the dentist. And I must admit, I know very little about this gentleman. For all I know, he is a dentist. Are you? You're not. Okay. All right, so I'm just going to pause for a sec. So we've just finished putting in that local anesthesia, and I'd like you to tell me how sore was that?
Not a bit.
Not a bit?
Not a bit.
What exactly did you feel?
I just felt a little prick of the needle when you first put it in. That's all I felt.
Right. And after that, no pain at all?
No.
And compared to going to the dentist?
Just about the same.
About the same as going to the dentist. So so are you upset that you're not asleep for this? Or?
No.
Okay.
I know you can do the job.
All right, great. So how was the whole thing?
How was it?
Yeah.
It was all right to me.
So it didn't bother you too much?
No.
Would you rather have been asleep or?
No.
When we are only doing the carpal tunnel, we use 1% lidocaine with 1 in 100,000 epinephrine. In this patient, where we were doing both procedures, we used 0.5% with 1 in 200,000 epinephrine. See the other 3 films for the carpal tunnel surgery, the local anesthetic injection for the cubital tunnel, and the cubital tunnel surgery.